Several countries have imposed strict COVID regulations on travelers coming from China. New cases have increased in the country after it dropped all COVID-related safety protocols. The South African Health Department says it will issue an alert if it becomes necessary to take precautions. We're now joined by Dr. Aslam Dasoo. He's the convener of the Progressive Health Forum. Doc, good to see you, and thank you very much for availing yourself this afternoon. What do we need to know about the new subvariant XBB.1.5? Is there a need to be concerned?
Good afternoon, Dudu, and best wishes to everyone viewing for 2023. I think at the outset, I think this is the correct decision that the government has taken. And if I can just give you a brief context of what's happening in China, that because of this very strict lockdown they've had, the zero COVID policy, and they've now abandoned it, we were always expecting a surge to occur, and this is happening right now. I think the vast population in China is making the absolute numbers look quite horrific to everyone, but we believe it's in proportion to surges we've seen in other countries when they exited strict lockdowns as well. All that being said, we have noted that several countries have imposed restrictions. The Omicron variant is the variant that is causing the surge in China. We have no reason to believe that there's a sinister variant that no one knows about that's doing that. And that being the case, and even our experts here are quite clear that it's the major subvariants of Omicron that's causing this. But Omicron has changed the nature of the pandemic from before. It is obviously less severe, but it is still within the ambit of giving us a pandemic emergency, as we can see at this point.
What would it then take to satisfy us that there's a potential threat?
Okay, so I think the important thing to understand is that up to now, and all the experience we've gained over this pandemic, what is absolutely clear is that travel restrictions of the type envisaged by several countries have absolutely no effect on stopping transmission or circulation of the virus. There's no evidence whatsoever to do that, which is why this approach by the government, our South African government, is absolutely correct. It's also in keeping with the majority of what other countries are doing. And it's not surprising. I think in a turbulent world like the one we live in, a couple of days ago, the Guardian newspaper in the UK published a report stating that the UK government had explicitly ignored the advice of the senior health authority to not impose travel restrictions. And so this indicates that there's probably a political posture being taken vis-à-vis China. But this must not cloud the issue at all. The Omicron variant is the dominant variant. You mentioned XBB, which is the dominant variant in the US at the moment. Several countries are experiencing an increase in cases. So this is not at all surprising. I think in South Africa in particular, we have a situation of widespread background immunity to Omicron, both through natural infection and through vaccination. And even if infected travelers do arrive in South Africa, it's not likely, in fact it's highly unlikely, that it will cause such spread to give us concern about any surge. So at this point, there's absolutely no reason for alarm. However, surveillance is at its peak. Everyone is watching this. There's sufficient international collaboration, and I know that the WHO is meeting the Chinese authorities today because there's been a concern about, lack of information coming out of China, and maybe things will become clearer. But at this point, we have no reason whatsoever to take any extraordinary measures.
That's a comforting thought. The government of South Africa, or the health department, has encouraged people to get booster shots. And so for people who are indeed worried, because the past couple of years has proved that anything is possible, right? And a number of things are beyond our control. And so what can an individual do to allay their fear and to allay their anxiety? Wearing masks again?
No, I don't think so. There's no advisory, suggesting that. Look, I think we are all, if I may put it this way, pandemic veterans. We know what we have come through. We understand much better how this virus spreads. We are still within the emergency phase of the pandemic, even though Omicron, like I say, has changed the nature of the pandemic to one that is milder than what has come before. There's no guarantee some nasty new variant won't emerge. But in terms of how the virologists look at it, it's not likely that that will happen in terms of viral evolution. What we are seeing is a range of subvariants of the Omicron variant, and these are, exhibiting some signs of immune escape to greater or lesser extent than others, but none have demonstrated complete immune evasion. In other words, your immune system at the moment, if you have been thoroughly vaccinated or have been previously infected and vaccinated, is sufficient to deal with the matter. However, we also know that, immunity wanes over time. We've seen that with even these vaccines. And the government has already opened up the availability of a further booster if your last booster was 6 months ago. And that would imply a 5th shot of those who have been using the Pfizer vaccine and a 4th for those who've been using the J&J vaccine. And I would urge everyone over the age of 55 to ensure they avail themselves of these boosters. Once your immunity is boosted, the likelihood of even getting infected drops dramatically. But if you do get infected, it will most likely, if you have been properly vaccinated, result in a mild illness. What we do know is that there's a robust immunity against severe illness, hospitalization, and death arising from the vaccination project that we've undertaken. Very important to understand that those in the high-risk category, and we've identified them, they're over 55s, they're those with comorbidities, and the older cohort of that group is even at higher risk. And they are the ones that should ensure they are thoroughly vaccinated. We have an over 60% vaccine coverage of that group, which is appreciable, but not where we need to be. It needs to be a lot higher, and we would encourage people, therefore, to do so. On other measures, non-pharmaceutical interventions, there's nothing further to advise on. There's no need for masking at this point. There's no need for, the sanitizing hygiene theater we've had, or any of that. I think surveillance at our ports of entry for people who are ill is sufficient, and if they arrive and they're ill, they'll be treated in the standard way. And that's another thing we have learned over the last 3 years, how to treat COVID. So there's really absolutely no need for alarm. Caution, yes, until we are out of the emergency phase of the pandemic, and that will be an international decision. And we should just be aware of developments as they occur. Listen to advisories from the NICD and the Department of Health, and we should be fine.
Dr. Dasoo, how then should we understand some of the articles that are making the rounds, and perhaps you could help us understand a little better, that suggest that the pharmaceutical interventions like the injections that are currently on the market do nothing for this new subvariant and they will not work? To your knowledge, is that something that is there?
Well, there are new antivirals that are on the market, like Paxlovid and others. Our availability here in South Africa is still quite low for those. The international literature suggests that they are effective if given at a particular point in the illness, less effective if given at other points in the illness. The variants and the subvariants, as you say, also demonstrate differential response to these drugs, but they're all we have at the moment. So the idea that we are in some war with the virus, that we have to defeat it, is just not tenable. What we have to do is to protect ourselves. So avoid, hanging around with people who are obviously ill and who need to be, isolated. Avoid very large crowds. And if you have comorbidities, the suggestion strongly is that you do all that it takes to avoid high-risk activities. And by doing that, I think we will prevent another problem that often emerges. Even if you get a mild illness, the likelihood of long COVID is high, and that is extremely debilitating. So the word to any ordinary person is that we know that this thing exists, we should be properly vaccinated, and we should, if we are in the high-risk category, just take sensible precautions. There's nothing to go overboard with here. The scientific fraternity is quite at idem around the world about these measures and about the state of the pandemic today. What will happen in China is that we expect that by mid to late January, the surge will peter off. They are taking a severe beating right now. There's no question. There are millions who are being infected, thousands who are dying. But again, we are dealing here with a population that's vast, and the absolute numbers may just seem alarming, but it's in proportion to what we've seen around the world.
Thank you for helping us make sense of all of that. Health is wealth, I guess. Dr. Aslam Dasoo is the convener of the Progressive Health Forum.